The COVID-19 pandemic, I think, as an infectious disease threat, is really unprecedented. Despite the fact that over the last 10 years we've had multiple epidemics, this is the first major pandemic that really has impacted many of high-income countries to the degree it has, and increasing, of course, emerging and low-income countries. The data really, in terms of both the clinical manifestations and its impact on various disease-specific groups, is really quite sparse at the moment. I think one of the things we've noticed is the data that's coming out is very epidemiological, and by that I mean it talks really about the numbers of cases, the sex distribution, geographic distribution, and also some degree of comorbidity data. But at the moment, when it comes to for cancer patients and the impact of COVID-19, we really know very, very little. And despite the exposure that many of our cancer patients are getting, we're still not collecting the data that's necessary to inform clinical judgments. And at the moment, the precautionary principle is standing. So my colleagues are essentially having discussions with patients about the risks of continuing chemotherapy, radiotherapy, having major surgery in light of the potential impact that a COVID-19 infection could cause for them. What's clear about COVID-19 is it's, as a global pandemic, it's getting into low and emerging countries very, very quickly. What looks like low infection rates at the moment is almost entirely due to the fact that many of these countries simply are unable to test their populations. So this is really going to have quite a dramatic effect in low and middle income countries. The issue I think is going to be is whether or not we really see this as additional mortality above and beyond what these countries are already experiencing. We're particularly noting at the moment the impact in South Africa, for example, where Cyril Ramaphosa has actually started a 21-day lockdown there. There are countries where the data collection is good enough that we'll be able to see what the impact is. But I think the impact of the lockdowns in particular, I think, is a major cause of concern in terms of economic and social stability, but also in the context of cancer patients. We're talking about access to cancer treatments and also ongoing cancer treatments. And it's a complete unknown at the moment what this is going to be. I mean, it's easy to see that access to de novo cancer treatments are going to be completely lost over the next 4 to 6 weeks, with meaning a lot of patients who could have presented with curative disease will end up presenting with late stage disease, and/or we're going to see patients already in care pathways who are going to be adversely affected because of COVID-19. Now, that may be because of the disease itself, exacerbating their condition, their morbidity, or it may be indirect. In other words, they're not able to access ongoing care. And I think we're particularly concerned, obviously, for patients in the palliative setting. How are they going to receive palliative chemotherapy, radiotherapy, palliative surgery during this period when a lot of services are simply being shut down or being shunted across to other care areas? So there's a huge amount of unknowns at the moment. And I think what the crucial thing is for colleagues around the world to very quickly share their experiences, even those experiences which are negative. So, for instance, we have no idea at the moment about the impact of COVID-19 in childhood cancer patients, in hemato-oncology, in those populations with high immunosuppressive risk. Now, it may be entirely negative. In other words, these patients are testing positive for COVID-19 antibodies, but they've shown absolutely no symptoms and there's been no impact at all. That is important to know. So every single bit of information about exposure, side effects, or indeed no effect whatsoever is important that we gather together and we actually publish this. And obviously, ecancer now with its COVID-19 portal is an ideal place to put this online very, very quickly.